you, Christina, so much for joining us today. It's great to have you.
Yeah, thanks for having me. Great to be here.
Great. Well, thank you so much. And I'm just going to introduce you a little bit, read your broadcast or your bio. I'm so sorry. Christina Sandifer is Executive Vice President at the Goldwater Institute. She also develops policies and litigates cases advancing healthcare freedom, free enterprise, private property rights, free speech, and taxpayer rights. Christina has won important victories for property rights in Arizona and works nationally to promote the Institute's Private Property Rights Protection Act, a state-level reform that requires government to pay owners when regulations destroy property rights and reduce property values. She is also a co-drafter of the 41-state Right to Try initiative, now federal law, which protects terminally ill patients' right to try safe investigational treatments that have been prescribed by their physician but are not yet FDA approved for market. Christina is the co-author of the book Cornerstone of Liberty, Private Property Rights in 21st Century America. She is a frequent guest on national television and radio programs, has provided expert legal testimony to various legislative committees, and is a frequent speaker at conferences. Thank you so much for joining us today, Christina.
Thanks for having me. Glad to be here.
Well, let's get started. We're going to dive in and talk about how government red tape has been affecting us during coronavirus and COVID-19. It's been very interesting times, but right now people are wondering when we're going to have a treatment, when we're going to have a vaccination for COVID-19. And a lot of times the government bureaucracy can hold that stuff up. Can you share a little bit with us about what that process has been like, especially right now when we're looking for immediate treatments and answers?
Yeah, I mean, unfortunately, there's a lot of uncertainty out there, and it's uncertainty that we're probably going to have to live with and deal with for some time. But there's been a lot of talk about how, well, in times like these, we really can't afford to have the sort of the slow, grueling drug approval process, that we're maybe able to afford in peaceful times or times of plenty or normal times, and we don't have a pandemic on our hands. And the truth is that although it's true that this is an unprecedented situation for Americans right now, we really can't afford this system ever, even in times of peace. This is an emergency, and so it's extremely important to get treatments to people as soon as possible. But just keep in mind that for anyone who is sick, for people who are dying, not having access to treatments that could, prolong or save their lives, that's an emergency. Over 500,000 Americans die every single year just of cancer alone. So our drug approval system is riddled with red tape. And we're really starting to see, I think, on a broader scale, what that means for Americans today. But just keep in mind that patients with terminal illnesses have been facing this system for decades. On average, it takes about a decade, sometimes 15 years, for potentially life-saving treatments to make their way through the FDA approval process. And what that process looks like is it's very cumbersome, and it tests not just for safety, but for efficacy. So, let's think about that for a second. Most people want to know if a treatment is safe, and it's true that we're never going to know that with absolute certainty. And that's something important to keep in mind, especially in times like now. The government does not have some knowledge that scientists and doctors lack, right? We don't, no drug is going to be perfectly safe in every situation. Acetaminophen, which is Tylenol, kills 500 people a year, right? So nothing is perfectly safe. Everything has risks. Everything has side effects. But the FDA wants to make sure that drugs aren't going to be killing people when we give them treatments. But then it goes farther. Then the drug approval system spends years and years and years trying to determine how effective the treatment is. And that is really the problem that I've been focused on. It's important for us to have that information. It's important for us to know, for example, how a drug interacts with other conditions or people of certain age groups, or how effective it's going to be in treating a particular illness. But as we try to get closer and closer to that certainty, which again we will never have, we're delaying that treatment, making that treatment available to people who need it now. And time is of essence, and especially in a crisis like now, time is not on our side. Time is not our friend. So getting treatments to patients as quickly as possible under the care of their doctors really has to be the name of the game. And the silver lining sort of in a situation like now is, since the emergency is so widespread and is affecting so many people all at once, we have seen a lot of the rules that typically slow this process down or stop patients from getting treatment temporarily suspended. And I know we're going to talk about some of those and what some of recent federal reforms have been able to do to help with that as well. But I would say then again, let's think about that, because if we're temporarily speeding things up or temporarily suspending rules that are getting in the way now, we probably shouldn't ever have them in the first place. The entire point of these rules is supposed to be about protecting public health. And if they aren't protecting public health during one of the worst healthcare crises that our country has ever faced in modern times, then why are they there in times of peace and plenty? So at the end of the day, what the drug approval system should be about is getting the right treatment to the right patient at the right time.
Yeah, it's been interesting with during this time, and people are looking for answers and solutions, and unfortunately we're ready to have some answers soon. Executive orders, some people think that might be the answer to cutting through the red tape, but other people worry that might be too much government overreach. How do we as a free society find a balance?
Yeah, so, one of the interesting things, and I know we'll probably want to talk a little bit about the federal reforms and at the federal level, because there's so much, of course, in healthcare and in drug approval that goes on at the federal level. But keep in mind that the federal government and the FDA is not in charge of the regulation of the practice of medicine. In fact, that is specifically a duty of the states. And so there's a lot that happens on the state level, and a lot that's going on the state levels right now. Now, it's true that in times of emergency, governors do have broad powers to issue executive orders, and that makes sense. Legislatures are out of session. These are emergencies. Things have to happen. But we should be cautious about the exercise of those powers, as you say. It is good that we're focusing a lot on the state level. Of course, outbreaks are going to vary geographically, right? New York City is really hit hard right now. Some other places like Arizona or, somewhere in the middle where I am, everywhere's going to be a little bit different. And so we need quick responses that can really respond to local conditions. But of course, again, executive orders are fine in times of emergency, but they can quickly devolve into something that could be really problematic. To me, the basic principle when it comes to healthcare or any executive orders is making sure that emergency measures and emergency health measures are tailored toward what's necessary to protect health and safety, and temporary if they're expansions of government power. If they are regulatory rollbacks, which is a good thing, then we should make them permanent. We've seen some executive orders related to health on the state level that have gone way too far. The FDA finally got to the point of approving at-home tests for COVID-19. So you can actually do self-swabbing and collect samples yourself, which is great. That means you don't have to go out and be around people who might be sick. And there are several states, including the state of New Jersey, where they've actually had a lot of cases that are prohibiting that test at home. It's totally unacceptable in a time of emergency. You were talking about treatments. There's a lot of talk about a treatment out there called chloroquine. Again, nobody knows if chloroquine, how effective it is, or if it's effective as a treatment or prophylactic for COVID-19. But it's a treatment that's been around for almost a century. It's FDA approved to treat things like rheumatoid arthritis and lupus. It's relatively safe. We do know that it can be unsafe for people with heart conditions, but it's relatively safe. And of course, it has to be prescribed under a doctor's care. It's perfectly legal to do that. It's FDA approved. And yet some states like Nevada are telling doctors that they can't use it except, in hospitals or under certain situations. So these are the things that we should be concerned about. On the same token, there are some really good regulatory rollbacks out there that are being done by executive order. Suspending certificate of need laws. I know that you've had Shoshana Wiseman on previously to talk about that. These are laws that require you to prove that a healthcare service is needed, prove it to the government, and get the bureaucrat's blessing before you're able to offer it. Well, in times like these, we don't really have time to do that, and there's clearly a need. allowing healthcare providers that are licensed in one state to come across the state line and continue to practice. Believe it or not, that's illegal in many states. My state of Arizona, the Goldwater Institute, worked to make that a permanent law so that people who are licensed to do professions in one state can come to Arizona and bring their license with them, because guess what? You don't forget how to do your job once you cross the state border. Removing restrictions on scope of practice. People go through med school, and medical professionals go through school for years to learn how to practice. And then there are laws set up that say, well, nurses can't do this, only doctors can do this. Pharmacists can't do this, only doctors can do this, when they're all trained and competent to do various things. We're seeing those things get scaled back through executive order, which I think is great because they're necessary, because those rules were never needed in the first place, and they stop medically trained professionals from doing their jobs and getting treatments to people. But now, again, the focus then has to be, let's make these things permanent. When the legislatures come back into session, they need to make the good things in these executive orders permanent, and the bad things, I think, need to go away.
Yeah. And talking about legislation, I know you have been a co-drafter of the 41 state Right to Try initiative. How can the government use this initiative or enact similar ones to allow COVID patients to try not yet FDA-approved treatments?
Yeah, Right to Try is just such an amazing effort. It was our true grassroots state-based effort that made its way all the way up to Congress. I know you said that you worked on it when you were on the Hill, so it's been so exciting to work with so many people across the country on it. Right to Try, is so simple. It protects the right of terminally ill patients to get access to treatments that are safe but aren't fully FDA approved if their doctors think that's the best option for them, so that they don't have to wait through that long 10, 15-year process we were describing. I think that Right to Try couldn't have come at a better time, because it's clearly given the FDA a new mandate to meet the immediate needs of patients that are facing life-threatening illnesses or that are very sick with things like COVID-19. As new treatments are discovered and developed and being tested, patients, as a result of Right to Try, are going to immediately have access to more options than ever before. But I also think that besides just the practical effect of Right to Try, which, again, even before COVID, was saving lives and getting treatments to patients, it has changed the way that we think about government, right? And the way that we think about the role that government should and frankly shouldn't play in determining whether a patient has access to a potential treatment. And so I think there's an opportunity to really expand on Right to Try, using the spirit of Right to Try, applying Right to Try to personalized medicines. These are treatments that are custom made for individuals to treat their particular anatomy and situation, removing restrictions that are out there at the federal level that actually tell doctors that they can't get cutting edge information from drug manufacturers that they need to treat patients. It's crazy. It's been federal law for decades. And that, of course, is going to hamper doctors in times like these. And also allowing for things like international drug approval, reciprocity. These are things that continue with the spirit of Right to Try. And the bottom line and the lesson that we've learned from Right to Try is that a person owns her own life. And so the right to make personal medical choices is yours, and it's fundamental, and that people should be able to decide these things in conjunction with their doctors, and they shouldn't have to get a bureaucrat's permission first.
Yeah. Great. Yes, I did get to work on that when I was on the Hill. So I was really excited to see that you had been so involved in that. You've suggested in some of your writing that we try international drug approval reciprocity to harness the important scientific work that's being done in other countries. How do we make sure other countries are also held to the high standard of medicine in the United States? Or is that a barrier that we should be eliminating in a pandemic like this?
Yeah, that's a great question. We have been advocating for international drug reciprocity, which the proposal that we're advocating for would actually use scientific work from other countries that have the same or similar rigorous scientific drug evaluation process that we have in the United States. So it's true that I think in many cases what we have here and in these similar countries is probably too much. It's good to always have that information, but it probably doesn't need to all be out there before doctors start using their best judgment to give treatments to patients. And of course, we see that the FDA makes exceptions all the time, right? Right now, they are fast tracking approval of some promising drugs that might reduce symptoms in patients who have COVID, that might help treat it. That's great. In the Ebola crisis from not too long ago, the FDA gave treatments that were not approved, that hadn't even been tested on humans yet, even for safety, to American doctors who were overseas helping with the Ebola crisis and had contracted it. And again, those aren't bad things. Those are good things, that we're getting emergencies treatments to patients when they need them. But what that says is that the current system, that should be the rule, not the exception. And so international reciprocity for drug approval with countries that already have our high standards, it seems like a no-brainer. The idea is just that if a drug is going through the drug approval process in a country like somewhere in Europe or Japan or places with similar standards, that information is useful in the United States too. And currently, a drug would go through the approval process overseas, then it would come to the US, and then it would get held up going through that same approval process through the FDA. And of course, that delays Americans from getting access to drugs. And it also bumps up the cost because the testing is expensive. And at the end of the day, the patient or the taxpayer pays for that. So again, to me, it's a no-brainer. There's definitely built-in protections. And the idea would just be something that's approved in one of those countries would be approved here unless the FDA has a really good reason to be concerned about the safety, in which case it could undergo additional testing. So there's even that built-in mechanism. And we have seen a lot of these principles embodied in Senator Ted Cruz's Results Act, which he has actually modified to deal specifically with COVID and epidemics. So I would love to see that pass. I think that would make a huge difference, especially now when literally the whole world is dealing with this. There's no reason why we shouldn't be sharing scientific information from trusted countries to help American patients.
Wonderful. Well, Christina, thank you so much for all of that. We're going to be turning now to some Q&A from our audience. We got some great questions, including how does the FDA drug approval process compare to approval processes in other countries? Now, you touched on that a little bit in the last question, but.
Yeah, it's a great question. And to be honest, the FDA drug approval process is certainly not the worst in the world. There are countries that have much lengthier, much more bureaucratic drug approval processes for all of the legitimate complaints about the system we have in America. It is better than the standards in many other countries, but there are places like Japan that have allowed for things like adaptive trials. So one thing that's really frustrating about a clinical trial, your typical clinical trial in the United States, is not only how long it takes to test these drugs, but the fact that some people that enter clinical trials get placebos, right? So imagine you're a dying patient and you enter a clinical trial hoping that this drug will help you. Well, you may be given, a sugar pill and never even get the chance to try that treatment. And by the time you are able to try it, it might be too late. In countries like Japan, they have adaptive clinical trials where once they start to learn and get data that they need, they can start putting more and more patients on the treatment instead of having them on placebos. There are fast track procedures in other countries where if one drug is kind of, tested on a couple individuals or if it's given to a couple of individuals through what would be like the United States expanded access, then more people can get it. And so we do see a lot of rollback of red tape in other countries that I think would be helpful to adopt in the United States. But again, just because we have one of the better drug approval processes in the world does not mean that it's perfect. It doesn't mean that we don't see patients every single year leaving the United States, traveling to Europe, sometimes moving to Europe and other countries to get access to treatments. And it doesn't mean that we can't do better. We're an enormous country. We have very entrepreneurial, resourceful people here. We have good doctors and medical professionals, and we need to let them do their jobs.
Great. We have another question here. Why are there so many restrictions in the first place? Were they necessary at one point or just regulatory capture?
Yeah, we could do 3 hours just on that, right? But the short answer is when we look at the federal system, when you look at the FDA, the FDA has been around for about 100 years. When the FDA first came online, information was not as easy to come by, right? Patients these days are very well informed. You can go on the internet and find lots of information about treatments and potential treatments and diseases. And there's a lot of bad information out there, but there's also so much good. And doctors have information or access to the information, and people can criticize bad information, and people know a lot more. Well, back when the FDA was formed, we had to kind of rely on what companies told us about products, and the concern with the FDA was that a lot of things were misleading or were mislabeled, and we've all heard of the snake oil salesman that just goes out there and says, "Hey, this treatment will cure everything," and so the FDA's point when it was formed was pretty limited. It was supposed to just make sure that they were empowering patients with the information, the truthful information that they needed to be able to make their own decisions. And little by little by little, as it happens, right? Bureaucracy is a one-way ratchet. It goes up. More and more and more regulations have come. Things have expanded. As our society has gotten more complicated, that's been an excuse to regulate more. And now the FDA looks very different. Now, instead of being an organization that empowers individuals to make their own decisions with their doctors, it's actually an agency that thinks it gets to be the one to make the decision as to what risks you're willing to take, because it doesn't think that you can be trusted to make that decision. And a lot of these changes have been well-intentioned. They've been in response to, people who say might take a medicine that actually ends up making them sick. And so then there's a push on behalf of the FDA to make sure we protect everyone. But again, the truth of the matter is just that life is not without risk. And I think that is the problem, is that when you get a bureaucracy, and you get somebody who is an agency that is extremely well staffed, and you have people who think it's their job to make sure that they minimize all risk. And that's just impossible. You can't do that. And we wouldn't want to do that, because that means we can't live our lives, and we don't have the potential to try to live our lives and to try to improve our lives. And so, it's just, the problem is once bureaucracy grows, it's very hard to scale back. That said, again, we have seen, and right to try was inconceivable, that something like that could pass on the federal level just 5 years ago when we started it. 41 states passed it, Democrats, Republicans, near unanimous in most state legislatures. It was bipartisan, as you'll recall, at the federal level. It's just, and it has gotten patients treatments in the short time that it's been on the books that otherwise wouldn't have gotten treatments in time. So I think there's reason to be hopeful, but I think this is the reason why, especially in times of pandemic, and this goes beyond just healthcare, this is for any regulations we're putting into place right now, we have to be very cautious, because things that are often seen as temporary or put into place with good intentions to prevent or help a particular circumstance, oftentimes they don't go away, or they aren't narrowly tailored, and they're allowed to blossom. And then we see all these unintended consequences that we see today.
Gotcha. Super fascinating. And it's great to hear that it has benefited even patients since it came into law. So that's exciting to hear.
One of my favorite patient stories, and in fact, he's very active on Facebook, so you can find him on Facebook. Matt Bellina. He's a veteran in his 30s, a father, a husband, just a great human being, just a hero. And he has ALS. He advocated for right to try, thinking it probably would never help him because his condition continued to decline. He was actually not able to speak or walk when the bill was signed. But then he got treated, and nobody knows how long the good results will last. Nobody knows what is in store for him long term. But he's gotten better. He's seen improvement. You can see videos on his Facebook page of him lifting himself up out of his wheelchair with his own body strength, lifting weights, working out. He can speak. He can sleep without a breathing machine. He actually came to the Goldwater Institute last year and gave us had a standing ovation from hundreds of people for everything that he did and for the improvements in his health. And so he's one of just many stories, but it's just amazing what role, people think about regulation in sort of esoteric terms, but these are the faces of people who can really be helped by scaling back on regulations that just aren't necessary.
Hmm. That's really cool. Thanks for sharing that story. One question, Aaron, Arizona has been innovative. What other states should we look to for new ideas?
Yes, Arizona has been innovative for a number of reasons. I like to think that one of them is that the Goldwater Institute, my organization, is headquartered in Arizona, and we like to use Arizona to experiment with our ideas and test out our our freedom legislation and litigation, and then just bring it all across the United States with a network of fantastic allies that we have to help. So Arizona is great. Tennessee has done a lot of really great things. There's our friends out there at Beacon Center that do really good work. They have done a lot to roll back on licensure, on regulation. There are actually 6 states, including Arizona, that have passed versions of what we call breaking down barriers to work, which I alluded to earlier, which is a law that says if you are licensed to do a profession and have done that profession well in one state, when you come to another state, you can bring that license with you. Obviously, that's extremely critical right now when it comes to medical professionals, but it's also going to be important for economic recovery, right? Our economy has just been absolutely decimated by this disease, and we need to get people back to work. And one of the ways that we can do that is by allowing them to practice the profession that they're trained to do without having to go through unnecessary red tape. And so there's a number of states that have taken that up and passed that. So there's been some good things done in Texas. There's been some great things done in Utah. Um, there are a number of really good states and really good state groups across the country that have worked with us to get these things done. And I think it's good that people are asking questions about the state level because frankly, everyone looks to the federal government in terms of crisis. And there's a lot we need to scale back on at the federal level, but there's a lot that can be done at the state level to protect our healthcare, to get people back to work. And so it's really important to work with local state think tanks and to look at state legislatures and state courts that have constitutions that can protect people's rights to a greater extent than the federal government. I think that we also see that when states band together and push for an idea like right to try, then Washington can no longer turn a blind eye. And that's when we're really able to make something that might just be an idea in a couple of states the law of the land.
Great. Well, thanks for that. A couple more questions have come in. Do you think we're too reliant on China in terms of drug manufacturing?
Yeah, we certainly hear a lot of people talking about that these days. I will say that I think we are too reliant on regulation when it comes to drug manufacturing and drug innovation. I think that a lot of things it's true, outsourced and made in other countries. And in times of pandemic or in times of, it's difficult with countries like China that are really totalitarian countries, right? So it's not an issue necessarily of even dealing individual to individual, but you're dealing with a country that is very much governed by, by a government, by bureaucrats that get to make decisions. And so it makes things really difficult. I think the fewer regulations that we have and the more, frankly, open trade, the more we're able to do things, not just within our borders in the United States, but also with other countries, especially countries that are very similar to ours and that are trusted and that have governments that are freedom-loving governments and that allow their people to experiment and prosper and be entrepreneurial, the better. The reason that we're stuck sometimes without those options, frankly, is because the type of regulation that we have here in the United States. And, you talk about China. Again, it's amazing how many people, and these are, of course, only people with the means to be able to do this, but that have to leave this country and go to other countries, go to countries like China, but also go to countries like Japan or Mexico or Israel in order to get medical treatment that, frankly, should be available here and could be available here under our standards and using doctors that are practicing in the United States, but aren't because of regulations that we have here within our own country. So it's one of those situations where I know it's easy for people to think, well, what we need to do is cut off relationships that we think are harmful. But my recommendation is no, we need to scale back on regulations here that are forcing people in our country to have to look elsewhere for solutions. And we should break down regulations that make it harder for us to work with trusted partners and people who can really provide us with treatments and solutions.
Great. Thank you so much. One of our final questions. This is from Julia. It's how can we join the Goldwater Institute?
Yeah, I like that question. That's a great answer for you. First of all, we have a website, goldwaterinstitute.org. If you go on that website and you're interested in learning more about our healthcare work or our specific response plan to COVID-19, which goes far beyond healthcare. It's a bunch of actionable items that you can take to your state legislator. Things to do with healthcare, with the economy, with education. You can find all of that on goldwaterinstitute.org. You can also find opportunities on that website to support us if you're so inclined, to join, become a member so that you can get up-to-date information on our events. We're doing a lot of events virtually, like new is these days. So you can get information on that, on our live events when it's safe for us all to be together again in person. And you can also follow our blog at indefenseofliberty.blog. We have daily commentary on there right now. It's very COVID focused, but daily commentary on there as well. And we'd love you to follow that and share it, engage with us. Reach out to us on social media. Goldwater Institute is on Twitter and on Facebook. But really, if you like what you hear, if you like what you see, I encourage you to be a member, and I also encourage you to circulate that information because, at the end of the day, that really is how we make things more patient-centric. That is really how we get good ideas out there, right? Is we share them so that more people can understand and more people can advocate for the things that we all believe in.
Wonderful. Well, Christina, thank you so much for joining us today. It was such a pleasure to talk to you.